Hello, everyone. I'm Dr. Pavel Krastev, DDS from New Hyde Park, New York. It is with great honor that I'm here presenting this webinar today. We have a very special guest that I will introduce shortly. I'd like to welcome all of you on behalf of the Global Summit Organization and myself, and I'm very proud to be here. It's a blessing to have so many colleagues from across the world come together and share knowledge, share their experiences, share their stories freely and willingly with the world, with all of us. This is what makes us strong. This is what gives us power. And most importantly, we're blessed to become such wonderful friends each day. Our friends grow and grow, and I consider it a blessing that I have so many now that I call brothers and sisters. So we thank you in advance for joining us. It's going to be a beautiful day. We have another partner right after ours. And, I guess we all hope. We're all going through a very difficult time across the world. COVID has been a nightmare for all of us, and is affecting different places in different rates. It attacks with no discrimination. Luckily, I could say that the good thing that came out of COVID is that it brought us together in dentistry. Certainly, we became stronger. And thanks to such wonderful efforts that we all make, we made the crisis essentially bring something good out of it. And that's to unite us. So without further ado, we have a very special guest from Canada, and to be more specific, from Toronto. And I'd like to introduce to you guys a dear friend now. Okay, Dr. Maziar Shahzad Dowlatshahi. He's a very talented individual on many levels. And what I will do now is briefly go through his resume. I'll read it out to you guys. And then I will invite my new friend to basically, we'll talk a little bit about where he comes from, what he does, what motivated him to become a periodontist. And he'll tell us his life story in a synopsis. And then, of course, we'll have a wonderful presentation that I believe we'll look forward to. So let me introduce my dear friend now, Dr. Maziar. So Dr. Maziar is, let me get my glasses on. Sorry, guys. And by the way, one thing I want to mention that I did not mention, we are having a hurricane approaching New York. It's currently passing Florida, and we've been having power spikes with the electricity. So in case the presentation gets interrupted, we lose power again. It's happened already 3 times this morning. Please forgive us for the inconvenience. So anyway, Dr. Maziar earned his DDS degree from the Shahid Beheshti University in Tehran from 1989 to 1994. He did a Master's of Periodontics, also at the Shahid Beheshti University in Tehran from 1997 to the year 2000. And he did a fellowship in implant dentistry. He has served as an assistant professor in the Department of Periodontology in the Interdisciplinary Dental School, Ahvaz, Iran. He's also been the head of research department in the Jundi Shapur Dental School in Ahvaz, Iran. He's a member of a research board of Jundi Shapur University of Medical Sciences in Ahvaz, Iran. Member of the editorial board of Journal of Jundi Shapur University of Medical Sciences. That's quite an accomplishment. He's been also in private practice, limited to periodontics and implant dentistry for with more than 15,000 implants placed. Wow, I can't say I've come close to that, but okay, that's fantastic. He also serves as the chairman of International Minek Study Club in Iran, Dental XP expert, Minek honored member and lecturer, and member of clinical research affairs at the Kolonaf Company, Canada. Wow, he's also an author. Publications and presentations, very interesting. Lectures and presentations in Iranian and international congresses and symposiums in Iran, United Arab Emirates, South Korea, Romania, Switzerland, and Canada. Instructor in many hands-on training courses in Iran, United Arab Emirates again, Switzerland, and South Korea and Canada. He has done several publications and posters regarding presentations, and he's authored a book called Decision Making in Periodontics, and that's done through Memorial Publications 2000. I guess you're also an innovator, which I salute you for. Development of a decision support system called DSS in periodontics, which is essentially artificial intelligence, and it's an algorithmic software. Also, development of decision support systems, DSS again, in determining prognosis and survival time. Oh, very, very impressive resume, which I will definitely invite my new friend to expand on. So, Dr. Maziar, tell us what inspired you to become a dentist, then what inspired you to become a periodontist, and tell us generally now just a little bit about your life. What are your hobbies? What are your inspirations? What motivates you to share with the world? Why you're here today? How has the entire COVID crisis affected your life? Please feel free to join us and just let us know.
Yeah, thank you, Pavel, dear Pavel, my dear friend. Thank you for inviting me to this amazing and impressive peer-to-peer global summit from all over the world. It's a great opportunity to talk about dentistry, implant dentistry, because in this time of pain and sorrow that all of us, many of us, confined to our homes, confined to a different kind of inhabiting the 24 hours, day and night. It's very nice to think about who really we are and what I am so passionate about. It's good time to think about many things from different point of view. And one of during this time of sorrow and viruses and disease, there is also happiness and some good things about it. You can see how much people working with each other, how much people helping each other, recovering patients. It's very good. Our part is share our knowledge to our colleagues, to our friends, about what we know about dentistry. It's good time to talk about these things, share our ideas or concepts. It's very good, and I so appreciate, and it's a delight for me to be part of it. Thank you, Pavel, and Dr. Keanu. Thank you, all of you.
It's our pleasure to have you, and I think one thing that I'd like to mention is dentistry. Since I graduated in 1993, I believe you graduated in 1994.
Yeah.
And back in my day, on the board exams, we used to do gold inlays. And gold inlays were one of my favorite restorations because they last forever. I mean, but dentistry has changed. Dentistry these days is exploding in so many directions with softwares, with the literature, with digital dentistry. I mean, it's very difficult to keep up with everything going on. I mean, I personally wish I had, maybe 50 hours in a day, so that I can have more time to study and to learn and to watch everything going on. Because you know what? You cannot be an expert in everything.
Yes.
And in my humble opinion, there's so many things that I want to learn. There's so many things that I don't do because I don't know how to do them properly. And that's why I congratulate you and the rest of the audience in the world for coming together to do this, because this is how we learn. I mean, I've learned more in this last 3 months than I have done in probably my whole career. And this is thanks to all of our doctors around the world and all their auxiliaries and everyone coming together to make this happen. I mean, this is something that I never imagined, but it brought us yet closer. And from here, all we can do, all of us, and I mean all of us, the audience, you guys, you, me, everyone, we can just fly together, and fly forward.
Yeah.
So tell us a little bit about your hobbies. What do you like to do in your spare time?
Yeah, thank you for asking this. Before that, as I mentioned before, as you mentioned also, that it's a very good time to think about many things. And for example, in dentistry, there are so many topics we can talk about it. We should learn about this, especially in this time of digital things, digital dentistry. It's good to think about what we are so passionate about in dentistry. It's just about, for example, for me, placing implant more accurate, uh, perfectly. It's about just placing implant, or maybe there is a bigger picture. Care. It's I think there is bigger picture. Caring about patients,
Yes. Oh,
helping our
absolutely.
patients. I think this is a good thing to change our daily disciplines, micro disciplines, especially in this time. Uh, Again, thank you. So yes, my hobby. Uh, After I started dentistry, because at that time, maybe you know that there are, especially in Iran, there was not so many options. If your school grade was great or
Mhm.
was good, there are two options. There were two options. You have to be a doctor or you have to be an engineer, something like that. So
Okay.
I like engineering, but I pushed or forced by my family to dentistry. Okay, I started dentistry, but I like it. I like it so much because I love to paint. I love art. I talk about it more. So I thought that dentistry is a very good thing. You have to have a sense of art, and it's an art and science, you know. So after that, I like to be a surgeon, and placing, especially implants, was very good at that time. So I decided to become a periodontist. But uh, besides, I started to writing screenplay and
Wow.
playwright. Yeah, because I loved uh, cinema and theater very much. I saw so many movies at that time, so I decided to write it, and it becomes better and better. And finally, I published two screenplay, and yeah, and the playwright, and I will show you in my
That's
presentation one of my last play that we
very,
had
very
a
impressive.
30-night performance in Tehran.
Wow.
I was as a director and writer, yeah, and designer. So it's good to. I think it's very important to have any type of art beside you. If you want to do it professionally, yeah, you can do it. Or if you have another job, it's good to have it art beside you because it helps you to move forward, to be sensitive in your life. Uh, yeah, it's. I think it's very helpful, and it's kind of when you do some kind of art, it's kind of doing meditation. You
Yeah.
disconnect from the other world, and you can digging inside you with this art, whatever, painting, writing, or everything, playing music. Yeah, it's kind of digging yourself and
It's it.
become familiar with your stranger inside you. You know,
It's
because we
it's
have so many strangers inside us.
I'm very glad you bring this up, and here is
Mhm.
why. When I was a young man, and I know this is supposed to be about you, but I can't help myself. Just throw a few things. When I was a young man, I came from a lineage of my father was a dentist, my mother was a nurse, my cousins were all doctors, dentists, everybody in my family, attorneys or doctors.
Thank
So when I went to college, they gave me a piece of paper and they said, "Well, what do you want to major in?" So I said, "Well, what the hell do I know? I know pre-med."
you.
So what? But why? I'll take it one step further. What made me the one? I always wanted to be a doctor to essentially earn respect in society, to
Mhm.
help people. And I also, my whole life, I've always loved to build things, model airplanes, and I said to myself, what kind of doctor can I become? See now, and most people in my time wanted to become medical doctors, and
Yes.
and many people think that Unfortunately, I think I would disagree with this. Many people believe that people who didn't make medical school became dentists, and I think that's a fallacy. I never applied to medical school. I had a 3.9 GPA in college. I could have gone anywhere at any university. I got accepted pretty much everywhere I applied. But the point is, I wanted to create with my hands. So I said to myself, dentistry. That's what I want, dentistry. And you know what? I it was a crapshoot. Would I enjoy it? Would I not enjoy it? And from dental school days, I loved it. Doing wax ups, they used to call me. My nickname was High Speed Pav. I mean, anyhow, it's not about me today. But please tell us a little bit about the software you created. I'd like to know about that as well as the book that you've authored.
Yeah. As I mentioned before, my background was about engineering. My father was an engineer, very good engineer. So I had that background. I decided to implement it in my career in dentistry because I had that mind. So I decided to prepare a virtual periodontist mind with DSS decision support system, with utilizing artificial intelligence and logistic regression protocols and fuzzy logic protocols and so many algorithms. I started with sign and symptoms of periodontal problem and designed so many algorithms about this. And after that, I write the software with this algorithm. At the end, I design and I develop this software to make a diagnosis, treatment plan, and individual prognosis based on sign and symptoms of each or individual patients. And we put it in clinical trial with very good results and very high accurate. It's very good, and it's very good for teaching and teaching a dentist mind or student mind to how to start the questions and how to end it, and it helps dentists and students to organize their minds, organize the concept and mindset to make a very good and precise decision. Treatment plan, algorithm options for treatment plan, and prognosis based on 50% survival by time and 90% of survival by time. In prognosis, I put based on several articles regarding prognosis, for example, I put several articles that were about the prognosis and the odd ratio of each of elements affecting the prognosis. For example, access to that tooth, furcation involvement, mobility, smoking habits, several items with different odd ratios. When you put these different odd ratios into a multiple logistic regression, it works. To produce an estimation of what happened if each of these elements work together. You know that you cannot add these items alone. Every item has its own way, has its own odd ratio. So you have to put it in logistic regression to make an estimation about what happened if, for example, one patient has different access to second molar, maxillary second molar, has a smoking habit, also has a bruxism, and also mobility is grade 2, for example. When these factors working together, something different happens compared to another person, for example, without the smoking. And you can estimate the prognosis for that individual tooth and 50% survival time, for example, based on that prognosis for this tooth is poor, for example. 50% survival time is this tooth can survive 7 years. with this treatment, with this items, and 90% 4 years
Wow.
survival time. And that student can decide to retain, remain, or treat that tooth or not. It's very good for developing and organizing student mind. Yeah,
That's
I think.
amazing. That's really really amazing. I mean, I really look forward to your
Thank you.
presentation. So I guess without further ado, ladies and gentlemen, let me read Dr. Mazir's topic for the day, and then I will be honored to turn the podium over to Dr. Mazir for his presentation. So the topic of today's failure phenomenon: accuracy in seeking perfection in implant dentistry from a different point of view. So Dr. Mazir, I salute you on your accomplishments. I'll see you at the end of the presentation for some questions that we perhaps might have. And the floor is yours, my friend. And once again, I salute all the colleagues out there joining us. And love you guys all, and stay safe.
Thank you.
My pleasure.
Okay, I can start.
Please do.
Okay. Is it in full mode? Yeah.
I don't see it full screen yet.
Now
It's full screen here. Please proceed.
it's good. Okay,
Yeah.
you can see me. Okay. Well, implant failure. I'm gonna talk about implant failure, but first let me talk about something else. I mentioned before that it's very good to think about our passion, about what I'm really so passionate about in dentistry. We should think about these things, especially in this time of COVID, this time of viruses, and this time of you see inequality, the lack of evenness. These things that COVID-19 amplified it. So it's very good to think about our strangers inside us to make us a better person and wiser. Yeah, this is another stranger inside me. I love horse riding. It's so much. I love it. And desserts. Yeah, everyone, I think it's good to have a hobby to disconnect you from anything, to dig inside you, to know yourself better. It's very good. Also, another stranger inside me is a passion for theater. This is my last play, Requiem for a Girl. Third night performance. It was amazing experience. Yeah, you can see, and this is the one of its music. Yeah, Requiem for a Girl. Yeah, that was its trailer. So let's back to our work. Smiling. Smile is a key to aesthetic, especially in dentistry, in implant dentistry. We have to design it, we have to make it, we have to construct it, we have to reconstruct it, we have to redesign it for our patients to make them happy and satisfy them. Smile is a key to aesthetic, and it is hard to make this. But let me show you something. What if in this time this mask become a main part of our daily clothing, in advertisement clothes, in fashion design clothes, and in fashion clothes, in daily use, at work, in socializing, everywhere. You have to see this mask. Maybe change the smile design. Maybe it changed, and maybe we have to go back to functional part of our implant dentistry. As you know, function and aesthetic is the main goal of implant dentistry. Maybe we have to go back to function. I just wanted to bring it up to look at it from different point of view. But still, all of us know that smile is a key to static. Okay, implant dentistry. All of us know that it's a predictable treatment. A long way since 1980, from that situation to this harmony of aesthetic and function. All of us know that. Trends demonstrate a strong need for implant therapy, and demands are getting more and more. By age 50, the average American is missing more than 12 teeth. The trend is getting more and more. The success rate is higher than any other treatment plan, any other options, with more than 97%. I talk about this later at the end. And with many benefits. We know this. Preservation of alveolar bone, preservation of adjacent to the structure, increase the stability of removal prostheses. We know this. So many benefits. Look at these slides. This situation could be prevented from the first place with precise decision making, with precise diagnosis and treatment plan. I'm talking about this. It's very important when you decide to whether or not to retain a teeth with prognosis of with hopeless or questionable prognosis. It's very important to consider that allowing progressive bone loss to continue maybe compromise your future treatment plan, such as this situation that could be prevented from the first place. So I emphasize on precise decision making and treatment plan at the right time. And also preservation of tooth structure. But complications occur. And lengthens and complicate all of our process, jeopardize all of our efforts, further cause an additional process, and nobody likes this. Nobody likes this complication like this, such as these situations. I'm not just talking about osseointegration. All of these are failures, static failures. Nobody likes this. Not about just osseointegration. Static is very important. So failure in static is still a complication, is a big complications and failure. We want to talk about this to reduce this complication and increase your success rate. So for doing that, we have to know major implant success or failure predictors. They are same. Patient-related factors, implant characteristics, and clinicians' experiences and knowledge. This is very important. Thomas Linkevich's in his evocative book, Zero Bone Loss Concepts, talking about these factors, in other words, operator-dependent factors, misdiagnosis factors, and zero bone loss factors. We want to talk about this. If we want to increase our success rate or decrease complication rate, we have to know these factors. But I talk more about clinicians' experience and knowledge, because that factor is more important than two other ones. Patient-related factors. We have to evaluate everything from patient view. Thick biotype, thin biotype, smoking habits, quality and quantity of bone is very important. And genetic polymorphism, I'm talking about this later, is still patient-related factors. And also patient demands. All of this is important, especially patient demands. Look at this.
People have suggested that I fix them, but I like my gaps. As my father used to say, son, your teeth are air-cooled. Gaps are openness possibility, room to savor. The greater the gaps, the greater the contact, greater the feeling.
So patient demand is very important. Maybe he doesn't like to fill the gaps. So patient-related factors and implant-related factors, another factor. Dimensions, coatings, loads, location. We have different kind of systems and implants. There is no bad implants or good implants. They give us their features. We have to decide which one of features is good for our patients in this situation, for example. Not for every patient, in different part of the bone, different kind of situation. They just give us the features. We have to use these features. For example, we need knife thread for some cases. We need tissue level implant for some, in other cases. So we have to decide it, but we have to know it perfectly. We have to know implant systems perfectly and knowing their features. Dimensions, coding, loads, location, different features. We have to know it because let me talk about something. Cognitive ease. It's a place in your mind. Let me talk about it with an example. For example, about the implant system, your implant system. When you have repeated experience with your implant systems, you have clear display and definition about your implant system. You know it perfectly. You are in a coherence mode with each other. You are in a good mode with your system. You are in a cognitive ease process and place in your mind with your implant system. When you are in cognitive ease with everything, you do it better. You are so familiar with this. You have you trust it. You feel good about it. You do it effortlessly. And in some complications and difficult situations, you can pass it with this cognitive ease mode. So it is very important to know your implant system very well. Maybe a system is better than your system, but if you don't have the familiarity with it, you're not get used to it, maybe you can not do it perfectly. So cognitive ease is very important, and you have to know your implant system perfectly because you are the rider. You have to know your horse perfectly in every climate, in every situation, in race, in jumping, in just in walking in a trail or manege, or with saddle, without saddle. You have to know it. You have to feel your horse. So you are the rider. I'm telling that among all of the factors, clinicians' knowledge and experiences is more important one. Let me show the implant story. You have a basic science after school. You have it. You know it. You know what you do, what you need to place an implant. A simple case. You know it. So you start with your simple case, placement with your basic knowledge, and you get your own personal way. This is very important point in your implant story life. You have to get your implant, your own personal way. After this point, you can learn from other experiences, from others, observation, going to classes, going to courses, going to congresses, and seeing webinars, everything. But you have to place implants before. Without your own personal way, you cannot learn too much from after this. So it's very important to get your own personal way, and after all of this, you can place advanced case. Maybe at the end, you see that advanced case is not very different from simple case. Maybe you think at the first it's a simple case, but it was not, or it is not. So it's an implant story. It's very important to know it, to increase your knowledge and decrease your complications. Okay, clinician's knowledge and experiences. Patient-related factors with implant characteristic factors together, merging together with your clinicians, with your knowledge and experiences, the result is precision decision making and treatment plan. So the success rate will increase and complication rate will decrease. Let me tell you something. Trends in implant dentistry. You know that 80% of implants are restored or done by only 20% of dentists. Why? Because of that lack of knowledge and experience. 80% of dentists have not utilized yet the full potential of dental implants. So what do you want? To be in the 20% or be in 80%? You have to decide it. If you want to increase our knowledge and experience about something, if you want to confront and face with your enemy, you have to learn his or her pattern, her behavior. You have to learn it deep. It's an art of war. Exactly for implant failure. You have to know its behavior, its pattern. It's very interesting that implant failure not randomly distributed among people. Implant failure has a cluster behavior. It clusters within subjects, not necessarily in the same area or quadrant. It means we have high-risk groups and individuals for failure. So, to put it more simply, more loss per patient, more loss per patient within individuals. It clusters within individuals. In an innovative analytic method with utilizing logistic regression to show the correlation within subjects and the risk of failure among subjects, it showed that risk among subjects varied significantly. Implant failure tend to cluster within subjects. More loss per patient. It's very interesting. 3,609 implants, 99 failure. Survival rate was 97.3%. We know that. But it's very interesting. 2/3 of failure in 1/3 of patients. So it means cluster behavior. Some patients are more susceptible for failure. More than one implant failed in 22% of patients. This is very important. This is the pattern of failure. If you see one failure in one patient, it's maybe you can see it more in that patient. So you should consider this. Half of failures in surgical phase, prosthetic failure more predominant in patients with more than one failure. Prosthetic related factors and occlusal more role in cluster behavior. This is very important. Prosthetic related factors. Okay. So implant failure act as domino effect that may cause more failure in one person. Domino effect in one person. This is the pattern of failure. So we have to know it if we want to reduce the rate of failure or complications. So to increase our knowledge or decrease the implant failure rates or complication rates, we have to go for interdisciplinary approach in implant dentistry. Work together, communicate with your friends, with your colleagues. Patient assessment considerations. As I mentioned before, everything should be assessed and evaluated in patients. Systemic diseases, bleeding disorders, you know that, heavy smoking, advanced age, skeletal growth, everything. Everything should be assessed on patient level. Systemic and dental, and not anatomic limitations, soft tissue, hard tissue, static and phonetic evaluation, lip position, smile line, gingival height, biotype, thickness, and bone architecture, quantity and quality. I said that in patient level. Everything should be assessed first. After communication, assessment of patient. Hard tissue, soft tissue, anatomic considerations is very important. You can use CVCT and digital planning. We are in a digital dentistry world. Digital workflow. You can have your patients three-dimensionally and virtually in your office, in your 3D planning software, and assess the bone quality, soft tissue quality, everything from cross-sectional view, sagittal view, and occlusal view, and plan your implant perfectly, prosthetically driven, and biologically driven. With these machines, with these tools, you can have a digital impression, you can record soft tissue, everything, soft tissue, hard tissue, and assess it in your three-dimensionally in your machine and your computer. You can use guided surgery to place implant more accurate and increase your success rate and decrease your failure rate or complication rate. You can use it in static mode or in dynamic mode. Place implant exactly where you want it to be, where it should be. You plan it before in your 3D planner, 3D software, 3D planner software. You design it before, exactly prosthetically driven and biologically driven. And you place it in right angle, right depth, and perfect angulation. And digital occlusion assessment and TS scan. You can use everything to increase your knowledge, to increase your success rate. And you can use tissue engineering. You can use everything you can, but please don't use them, don't get them just as a toy to as a show off or bring more patients to your office. It doesn't work like that. Based on your concept and knowledge, use the right tools, right systems, and right methods based on concept. I'm talking about this. Concept and mindset are primary and paramount. Methods and techniques are secondary. So use these techniques, for example, PRF, increase your healing ability, wound healing perfectly, soft tissue healing. It helps very well. So to look at from different point of view. Excuse me. In most of the courses and congresses, they will tell you what you need to do. They will talk about methods, how to do it, how to use your blade, how to use your drills, everything, what you need to do. But they didn't tell you who you need to be. This is very important. Who you are to use that two factors, using your systems, implant systems, and assessing patient-related factors. You are so important. Who you need to be. Back to this implant story. Who you need to be part of this, based on your knowledge, based on your power of inside you and your knowledge. I'm talking about this. Methods and how are secondary. The full mind, the dominant will, and warm heart are primary and paramount. For unless, like dressing a wooden image in the clothes of a man. Without that concept and mindset, we cannot move forward very well. So let's to put it in another way. When we come to live in a world with this kind of mistakes and common mistakes, and good is not good, good is enough, good is enough concepts, and do your best concepts was acceptable. I think at some point we have to stop valuing perfection. And these are the results we get. You can see this. For example, COVID situation, maybe a lab that was a lab mistake or ethical mistake, or this lack of evenness, that's disparity of the inequality. I mean, these are the mistakes. These are the mistakes we get because we don't go for perfect situation. We don't seek perfection. I think we need to get to it very soon. Let me tell you the example about these mistakes. For example, 99.9 accuracy. You think is very good. 99.9 accuracy. 99.9 accuracy in our hospital, in a pediatric ward, means that giving 11 newborn baby to wrong parent every day with 99.9% accuracy. We need to get to 100%. We have to seek 100% accuracy. This is very important. We need to seek perfection. So, for moving forward, the first barrier is good practice. Good practice is the primary barrier to have a greater one. It's like a confirmative coffee. It's a journey, outer and inner, like everything. Inner is your dream, your character, your esprit, your concept or mindset. Other journeys, your courses and webinars, classes, everything. The inner part is very important. We have to focus our inner part. For doing that, to increase your knowledge, decrease your complication rate, and seeking perfection, you need to prepare a solid practice foundation based on your 4 cornerstones: visions and dreams and concepts and mindset, character, team, and branding. These are 4 cornerstones for seeking perfection and increasing your knowledge. As I mentioned before, that's an important part for success rate. First one, your vision, your primary focus should be on effectiveness, not efficiency. Many of us maybe think about efficiency is very good. Efficiency means doing things to maximize productivity and profitability. It's not work. It doesn't work in dentistry. We have to seek perfection. Excellence works in dentistry. So we have to focus on effectiveness, doing the right things that maximize patient satisfaction and referrals. Doing the right things, effectiveness, and do it slow. As my dear friend Miguel Stanley talking about this, slow dentistry. Do it slow. And this is good time for doing this because we don't have we don't see so many patients every day. We have to see them one by one with the time distance, and we have time for good presentation. We have time for good diagnosis. We have good time for preparation, preparing our patients for better treatment plan, for assessing the prognosis, everything to design our implant in 3D software. It's very good. We have time to do this. So we have to focus on effectiveness. So the first cornerstone. The second one is your character. You know that. Character is different from talent. You have to make your character. Good, honestly, caring, enthusiastic, and fair is part of your character. You have to make them. And patient knows that. Good character is different from outstanding talent. You have to make your character. This is the second cornerstone. Your team, you have to develop a very good team. You are not the only person at the top of the pyramid. It's not like that. It doesn't work like that. You have a team. Your team should be perfect for everything, for presentation, for knowing about implant, talking about implant with your patients, and after your surgery, someone should talk about implants for recovery, for maintenance, to that patients see that she's working or he's working with a very good team and very professional team. You have to make your team. This is another workshop, this 4 cornerstone, but I'm talking about this a little here to show it better, to explain our presentation about increasing your success rate and decreasing your complication and failure. So you have to make your team. This is the third cornerstone of your solid practice foundation, and you have to make a good brand of you. Brand is not a flashy advertisement. It's a declaration of who you are, what you do, and how you do it. This is your brand. Brand is the image of you in your patient's mind. You have to make that image in your patient's mind. With this 4 cornerstone, you have to be well known and well regarded, both, to make a brand. With these 4 cornerstones, you can increase your knowledge and increase your success rate and decrease your failure rate. So aim for perfection, as I said before. It's very important. Forget doing your best mindset. It doesn't work in dentistry, in everything. We have to seek perfection. So less than perfection has consequences, as I said before. For example, in Merriam-Webster dictionary, 99.9% is very good, but in Merriam-Webster dictionary, it means more than 400 misspelled words. It doesn't work. We have to seek perfection. And less than perfection has consequences. So forget doing your best mindset. And do effectively, not efficiently. Do excellent dentistry on lesser people. We have time for this now. And don't do compromised dentistry on more people or a lot of people. So you have to have a long-range strategic planning based on your strength, weakness, opportunities, and threats. Thank you, my friend. Thank you for listening. Can you hear me?
I can hear you. Yes.
Okay.
Hi.
Thank you.
That was a wonderful presentation, and I took a few notes that I would like to mention a few things myself at the end, and of course we'll take some questions. I'm unfortunately not seeing the questions on my laptop, but I will wait for questions on my phone here. But a couple of things that I'd like to mention after I saw your presentation. For our younger colleagues out there watching with perhaps less experience, and there's a couple of things. Implants, when we place them, should be monitored very closely during the initial 4, 5, 6 months integration phase. Here's why. I cannot tell you guys out there, the younger ones, how often a loose healing abutment becomes loose because patients chew on these things. So when we do a single stage approach, meaning we place an implant and we place a healing abutment on that implant, well, guess what? When patients chew on these things, they create rotational forces. And I have seen cases beautifully executed in beautiful bone. All right. And the patient comes back a month later with a loose healing abutment, and guess what? I see ditching in the bone. All right. Right away, if you address the issue quickly, and you can get away and fix the problem. I have seen other cases, believe it or not, with a second stage, a two-stage approach, meaning you place your implant, you put a healing screw, you bury it under the tissue. And I have seen cases in my practice where the healing screw somehow under the tissue gets loose. And I see ditching and crestal bone loss. So for the younger guys out there, I urge all of you one fundamental thing. Monitor your patients very closely during the healing phase, because a stupid, silly problem, such as a loose healing abutment, can destroy that implant very quickly because bacteria start to colonize. Now, another thing I'd like to mention. Lately, I've seen implant dentistry is something that we can strive as, and I agree with Dr. Maziar 100%. We need to strive for perfection. We need to strive for gold, okay? But as dentists, we're fighting a challenge, and we can never duplicate what the universe created. We can try to do it, but it's very difficult, and we must be very cautious to explain this to our patients ahead of time. In other words, when I do an implant surgery, I sit down and I talk more than anybody else, believe me, with patients. That's why I have a very low volume practice, because I like to explain to patients that we cannot give guarantees. People who give guarantees, it bites you in the butt down the road, because I can guarantee you guys all who do implant surgery, you will lose a percentage of your implants. I've had cases lately, and I'm discovering more and more failures in people that are deficient in vitamin D. This has been a hot topic lately. A lot of people are talking about it. Dr. Shakroon did a beautiful presentation in regards to vitamin D and the coronavirus. And I want to personally take this opportunity to thank Dr. Shakroon for his beautiful presentation about, not so much he focused on vitamin D and implant failure, but he focused about vitamin D and the COVID.
Yeah.
And, after I heard this wonderful presentation Dr. Shakroon did, I started taking vitamin D, every single day. And probably I'm here alive to talk about it because of, as a thank you, Dr. Shakroon educating us and me about vitamin D and COVID. But now the same thing is happening with implant failures. All right. So I've had a lot of implants fail in the second molar region, in the first molar region on older patients. Of course, we all know failures are highest in the posterior mandible, posterior maxilla, due to the bone quality, etc. But I've had cases where I do the implant 3 times on one patient in the number, second molar region, and they don't integrate. They fail. So how do we get around this? The other very important point that I'd like to bring before we take questions, and let me just look at my notes here. Don't be a cowboy in your practice. I'm a general dentist. All right. My bread and butter, as I say in almost every presentation, is a single implant, 2 implants, 3 implants. I'm not an oral surgeon. I'm not a periodontist. There's so many things that you should not be afraid to refer when you're not sure. In other words, know your limits, guys. We all have limits. We cannot be experts in every single aspect of dentistry. I mean, there's guys like Dr. Brownman out there who, reconstruct faces. I mean, do I do that in my office? Of course not. So we are all here for you to come to us. And if I don't have the answer, or, Dr. Shah doesn't have the answer, then we're not afraid to reach out to the next level of a colleague who may perhaps have the answer for you. So this is what dentistry is about. We strive for perfection, but we cannot always achieve perfection. And we must be very clear with this with our patients. Different patients have different habits. Smokers, non-smokers, people, who don't brush their teeth, people who brush their teeth phenomenally. There's genetic components to periodontal disease. There's so much on the table, and patients very often come in the office and they think, well, I do this and I'm going to get an implant. And they think an implant is the God savior to everything. And that's not the case, folks. Implants, you must train how to do them in a pyramidal kind of fashion, grow with it, because placing an implant perfectly today doesn't mean you won't have a complication. You must know how to handle that complication.
Exactly.
In my practice personally, I don't do too much guided surgery. I know it's the new trend, and I love the concept of guided surgery, but you know what? In my hands, I just don't use it that much because I don't want to take on that additional cost to the patient. So what I urge all of you younger guys out there is first learn the basics of implant dentistry. First learn to plan an implant and do it with your hands, and then explore guided surgery. Because guided surgery is wonderful as it is, you must know, how to handle complications. So
Perfect.
learn in a stepwise approach. Let me see. I think that's about it on my comments that I made. Dr. Maziar, if you want to make any comments, and then we'll take some questions.
No, it's completely agree with you completely. That I mentioned about knowledge and experience. It's not about reading the books, as you said. It's about awareness and do it wisely. How you know it, how you, if you don't know something, you have to seek it, to get it, learn it, and implement it. So do it wisely, exactly, not do it period.
So it's about teamwork. It's about us
Yeah,
coming together and not
yeah,
being afraid to call a friend, a specialist, an endodontist, a periodontist.
yeah.
I mean, and another thing I want to mention, in my practice, I generally don't refer too many cases out, whether it's to an oral surgeon or periodontist. I kind of do many things myself, but I always try to do what's best for the patient, not for my pocket.
Exactly.
That's why I have an average practice. I'm not some, contrary to what some people think, I'm not some big financial success. I'm an average guy. I call myself an average, Joe Schmo. Okay,
No, don't
but,
say
but
that.
but here we are on a platform where we want to grow together, and that's the
Exactly.
beauty of it. And the other thing, lastly, I will say, because once you get me talking, I can't stop. You know, don't be scared to. You're not the only one out there. This COVID business and everything going on in the world, we're all depressed. We're all scared. We're all, going through a hard time. But
Exactly.
being together is just, it's a power that cannot be explained. So I thank all of you. I thank Global Summits for their efforts in bringing us together across the globe. And Dr. Maziar, I mean, that was a wonderful presentation. Now I guess let's take some questions. I don't see any my computer.
Mhm.
Guys, any questions out there?
I
Mr.
just
Ron?
uh,
Yep.
I just see all of our friends saying hello and thank you, and
Okay.
yeah, it was a compliment, not questions.
All right. So I guess we're pretty much done. And once again, on behalf of Global Summits and myself, we thank you, Dr. Maziar, for joining us, for finding the time in your busy schedule to do this for us. And I salute all of you guys out there, all of our colleagues, our friends across the world for making this possible. And I look forward to meeting all of you and shaking hands and taking a lot of pictures. But I like to kiss and I like to hug. So, on that note, I will say goodbye. Love you all. Stay safe. And we're always here for you.
Thank you for inviting me. Thank you for your great audiences, and thank you, Global Summit. Uh, yes, stay safe. Thank you, dear Pavel.
My
Wonderful.
pleasure.
Uh, let's keep in touch and stay safe. All of you. Love you. Stay safe. Bye.
Thank you so much. Bye bye.
Bye.